be safe, and we all like to be helpful. Yeah. So first of all, we're going to pray. We're going to praise Him. Dear Heavenly Father, we thank you for this gathering. We thank you for being here with us. Lord, we pray that you open all the ears and all the minds of everybody in here and everything that is taught. I pray that it is retained and everybody remembers what they learned. Lord, I just pray for protection over everybody so everybody remains safe and everything that they learn they don't actually have to use. Lord, and I just pray that nobody ever has to do CPR on anybody, and if they do, they remember how. Please be with us. Amen. Amen. Okay, so first things first. Anytime anything happens, whether it's small or big, like a car accident, a severe emergency, something like that, the first thing you're going to do is assess the situation, okay? You're going to ensure the safety of everybody. Like, say if somebody falls, you're going to pull the person away from, the ladder, or if the building is falling, you're going to pull person safety so nothing else like that happens. If it's a car accident, you're going to pull a person away from the car accident, away from the road. You're going to ensure safety. And then after that, you're going to assess the situation. Is it life-threatening? Is this person breathing? Does this person have a heart rate or a heartbeat? How bad are they bleeding? Do you have to apply direct pressure to save their life? Otherwise, they'll bleed out. Okay, so first you're going to ensure their safety, and then you're going to assess the situation to see how bad it really is. Okay, and then you're going to seek help. Right away, you're going to be in control of the situation. You're going to stay with the person that's hurt. And if it's something that needs help, you're going to seek help. Like you're going to yell, "Hey, friend, we need help over here. You go gather some help. You go call the paramedics." While you stay with the person and ensure their comfort and ensure that they're still breathing and you're just still with that person, okay? And then, so we'll start with the easy stuff. Wound care. It's a basic scrape or a basic cut, okay? First of all, if somebody falls and they have a scrape, the first thing you're going to do is you're going to stop and think about it. You're not going to run up and touch their blood. You're not going to run up and, "Oh, you have a cut." We don't want to touch because we don't want to give people germs on their cuts, and we don't want to get people's germs from their cuts. Okay, so the first thing is you stop and you keep your hands off. Okay? Next thing is you're going to look at the cut and you're going to assess the cut. We'll wait for just a second. You're going to stop. You're not going to touch somebody else's cut right away. You're going to assess to make sure that it's just like a small scrape and it's not bleeding profusely. Okay? And then you're going to wash your hands, or you're going to get latex gloves before you help the person put a Band-Aid on their cut. Okay? So whenever you wash your hands, you wash with soap and water. You don't want to put any germs on their cut, so we're going to get all the germs off. Whenever you wash your hands, you're going to scrub your hands for 20 seconds, okay? We're going to scrub between our fingers. We're going to make sure that all the dirt is out from underneath our fingernails and cuticles. You're going to scrub all the parts of your hands because germs tend to travel. Okay, so after you have nice clean hands, then you can help them either put the Band-Aid on their cut, or you can give them all the supplies to bandage themselves up. If somebody is known to be HIV positive, you might just want to give them their supplies to bandage their own cuts. Otherwise, you're going to want to wear gloves if you're handling blood on an HIV positive person. Well, you should wear gloves on any person, but especially if they're HIV positive because it can spread. Okay? And the first thing you're going to do is you're going to ask one of the mages, or if you know how to dilute this, This is an antiseptic, so this is gonna clean the wound. It's gonna kill all the germs that's in the wound. This is a concentrate. It has to be diluted. Okay, so you're gonna put like 15 milliliters of this into 300 milliliters of water. So basically a splash of this into a small cup of water. But one of the mages or an adult can help you with that if you feel like you need help with that. And then you're gonna take that solution and you're gonna dump it on the wound and let it sit for a minute. It might burn, but it will prevent an infection. I've never used this. I don't know if this stuff burns, but if it's like the stuff we have in America, stuff in America burns a little bit. But it's gonna help you feel a little bit better, okay? And then after you use the antiseptic solution, you're gonna clean it out. You're gonna make sure that there's no like glass in your arm or sticks or dirt. You don't wanna have any foreign body or debris in your skin because your body is gonna push it out. It's gonna create like an infection to cause that foreign body to come out. Okay, so you're gonna clean it and then you're gonna cover it with some sort of antibiotic cream or ointment, okay? Whenever you use this, you're not going to open it and put it straight on the wound because then we've just contaminated the entire bottle. Okay, whenever you use this, you're going to have clean hands. You're going to take it off, take the lid off, put some on a clean finger, and then use it on the wound. And we're never going to double dip, okay? We don't want to insert germs into the tube. Okay? Or if you don't know how much you're going to need, you can always just squirt some on the back of your hand and then go and apply it to the person. It's like a little built-in tray that you have. Because you never want to touch this like straight on there or like close to it because then this is just no good anymore and nobody else can use it after that. After you've cleaned it and removed all the debris out of it, you're going to cover it with a Band-Aid. After that, you're going to want to wash it with soap and water twice a day, morning and night, okay? If it's like a really bad cut, like Tim, let me see your arm. Stand up. Do you guys all remember Tim's cut? Yes. He had to have a Band-Aid on it for several days because it was still open. Okay, so he had to wash it 2 times a day with soap and water and keep it covered until it's scabbed over. So until there's a scab over it, you're going to want to keep it covered, otherwise germs can get in. Every time you wash it, you're going to monitor it for like signs of infection. Signs of infection look like redness. So if it like starts looking more red, like out here, or if it starts being warm to the touch, if it starts like oozing, like white stuff or green stuff, like it did. Or if it starts increasing in pain, if it doesn't start feeling better and it starts feeling actually worse and starts feeling warm, then that's the beginning signs of an infection. And then you would want to tell Auntie Alicia or one of the modules to take a better look, or Cece. At that point, you might need some stronger cream for it or antibiotics that the doctor can give you, okay? An infection on a wound can turn into a systemic infection in your blood. So we just want to take care of it very, very well at the beginning stages until it forms like a crust, a scab, because that's a protection from the environment and germs. Okay? Okay, thank you. Okay, now if we get cut, like if we're using a machete and slashing grass and somebody gets like actually a big cut that's more than just a scrape, you're going to want to apply direct pressure on it. You're going to want to stop and hope, well, you can't really get gloves in the matter of a second, but you're just going to pray that nobody gets cross-contaminated with any sort of infection. Okay, so you're going to put direct pressure on a wound that's like really bleeding. If a wound that's really, really bleeding does not stop with direct pressure, like pushing on it, or if you've covered it with a Band-Aid and the Band-Aid just keeps getting bloody, you put a new Band-Aid and it just keeps getting bloody, you're going to want to continue putting pressure on it for about 5 minutes. If the wound is like obviously like still like just gushing blood, you're going to want to apply a tourniquet. Does anybody here know what a tourniquet is? Besides Harley? Do any of the young ladies in this room know what a tourniquet is? Okay. So a tourniquet is like, kind of like a belt. It's a really tight device. Say that I have like, say I got slashed with a machete on my arm right here, and it is just not stopping no matter how much pressure I'm putting on it. It's just going to continue to bleed. So the next step would be to apply a tourniquet. So whatever you have in that moment, most of the time you don't carry around like a professional tourniquet, so you're going to have to make a tourniquet. You can take your shirt and you can rip a piece of like a string off your shirt. You can use a headband, you can use a shoelace, you can use a belt off your pants. But what you're going to do is you're going to just completely cut off the circulation from the injured area about like, say like 3 fingers above the wound. You don't want, like if you have a wound right here, you don't want to tie it off right here because then your entire arm is going to lose blood flow and it's going to have damaged tissue. If you have a wound right here, you're going to want to tie it about right here because everything below the tourniquet has no more blood circulation and you're at risk for losing that entire limb. But if you don't use the tourniquet and you just lose all your blood, you're going to be at risk for losing it. So it's better to put the tourniquet close to the wound, about 3 fingers away from the wound, and pray to Jesus for the best situation possible after that. Okay? Moving forward, burns. Basic first aid for burn care. First of all, do we know that there's 4 different types of burns, like different levels of burns?
Yes.
Okay, so if you burn, like if you just spill a little bit of hot water and it's just a little bit red on top, that's a 1st degree burn, okay? It's just on the surface, like more of an irritation. If you touch the pan and your arm blisters, if it's blister forming, that's a 2nd degree burn, okay? 3rd degree burn is whenever it burns through all the layers of your skin, down to like exposed fat tissue or exposed muscle tissue. 4th degree burns is extremely painful. It's like all the way down to the muscle and into the bone to where you don't even feel it anymore because all your tissue is completely burned off. So if you have a burn that's so bad that you don't feel it and it causes no pain, you need to go straight to the emergency room, straight to the hospital because that's like life-threatening, okay? But we're going to talk about the simple burns, stages 1 and through 3. For a simple like burn where it's just irritated or blistering, you're going to immediately just put your hand under cool water. We're not going to put ice cubes on it because the ice cubes can actually damage the skin around the burn. So you're going to place your hand under cool running water for like 10 to 20 minutes to cool the area off and to soothe the pain. And then after that, you're going to apply antibiotic ointment. You can use like the betadine cream. You can use, if we don't have any actual medical supplies, you can use aloe vera. You can cut a piece of aloe vera off and stick it in there. You can actually put honey on it because honey has antimicrobial factors. And it keeps the wound moist and it reduces the bacteria, the risk of infection. And then you're going to loosely cover it. For a burn, you would never want to put a very tight bandage. You would want to put just a loose covering over the burn, but it would have to be a non-stick. Burn wounds tend to like gape open and seep fluid. So if you put anything like gauze or like a t-shirt material, that material is going to stick to the wound, to the burn, and then you're going to be pulling off the skin that you want to keep there. So you have to use a non-stick. The first aid kits should be stocked with non-stick materials. Same with the wound. If you have a burn, you're going to wash it 2 to 3 times a day with just gentle soap, like dish soap and water, and then you're going to reapply the ointment and reapply a bandage on it. An important thing with burns is if it blisters, you're not going to want to pop the blisters. The blisters, there is a barrier between the outside world where all the germs are and your natural microbiota in your body. Okay, so if you have like a bad burn and you're just tempted to pop all the blisters, that's not a good idea because germs can get in and it can get infected. Burns tend to get infected and have pretty bad outcomes if they're infected because burns have a different healing process than a regular scrape. If the blisters pop on their own, it's the body's kind of way of releasing the dead tissue, so that's better for you if you can just leave the blisters alone until they're ready. Same with the wounds, you're going to monitor a burn for infection. If the burn is like spreading, or if it's like oozing any like weird funky like white colors or green colors, that's definitely a sign of infection. If it's getting hotter, or it feels like warm to the touch after it's cooled off, those are signs of infection. They usually show up like probably like 2 to 3 days later. If the burn is like through many layers of the skin, you're just going to want to see a doctor for professional medical like guidance and help. Moving on from burns. Moving on to HIV and AIDS. Living in like close quarters with somebody with HIV can be safe. There's no reason to stress about contracting HIV from somebody with HIV from like sharing drinks, giving hugs, eating off the same plate, sharing the same cooking utensils, sharing the same kitchen, sharing the same bathroom. That is typically like safe. Studies have shown that that's safe. HIV can be spread through open sores, like if you have a cut, it's spread through blood, it's spread through breast milk, and it's spread through like fluids from your private areas. Any bodily secretions coming from your private areas, front and back, that can spread HIV. So anytime that you go to the bathroom, if you have HIV, if you're HIV positive, you're going to want to wash your hands with soap and water just to make sure that all the germs are killed. HIV cannot be spread like in a swimming pool or after the HIV, like say there's like a blood splatter on something and it's already dried, it's very, very low risk after that. So HIV can only live outside the body for like a few hours. It's only, I don't know the exact number, but just a few hours. Let's see. Preventing like a spread of HIV, you're never going to want to share things like razors. If you shave your legs, you're going to want to have your own razor at all times. You don't want to share a razor. If you use like hair clippers and like you get a nick on your head and there's blood on the clippers, there's sanitizing spray that you can spray clippers with just to prevent the spread of HIV that way. You're not going to want to share toothbrushes because whenever you brush your teeth, sometimes like you can brush too hard and then you can get like blood particles on your toothbrush. And then if somebody else uses a toothbrush and they have like a sore inside their mouth, HIV can spread that way. And same with using earrings. Blood can be spread using earrings. Same with like sanitary napkins. We have to be careful using pads, like if they're soaked in blood and the blood is not dry and it's in a separate container. Just be careful not to touch like the trash can if there's like napkins in there or tampons. Definitely be careful in the bathroom. Also, prevention of illness with HIV. HIV positive have to be extra careful because the immunity is lowered. Your body's defense on fighting off illnesses is reduced if you are HIV positive, so you have to be extra careful around like uncooked meat, uncooked eggs, things like that, just because like if you eat like raw food, you're more likely to get sick from it than an HIV negative person. So just higher caution around uncooked food and washing your hands after you cook food, or if you don't. So like say you're making like meat and then you go and touch your eye. The way that HIV can enter the body is through your private areas, through your mouth, your mucous membranes, your soft tissue, and in your eyes. So if you have like something and you touch your eye, you're likely to get infected that way. moving on to general things, like what to do, how to handle period cramps, headaches, cold and flus, things like that, like at-home treatment, okay? Cramping is normal. I hear a lot of you guys want to go to the hospital when you have period cramps. Is it true? You guys want to take the day off and go to the hospital? Yeah, period cramps really suck. They're a real thing, but they are normal. And you can feel them all in the front, that's normal. You can feel them in the back, that's normal. You can feel them like in the legs, super sucks, but it's totally normal. There's different ways to ease the pain. I know the last thing that you want to do whenever you're like cramping and in pain is exercise or get out. But if you're laying in bed, like you're just getting more tense. Exercise is actually proven to help reduce pain. Exercise stimulates something in your brain that reduces pain, the feeling of pain. So exercising during the day, maybe not running a marathon, but just a basic general exercise. Just getting outside, walking, playing, dancing a little bit, that can help with pain. You can take like Tylenol or ibuprofen. Who gives the medication here? The muggies? You guys can ask the muggies for Tylenol and ibuprofen. But just the medication safety on the Tylenol and ibuprofen, the more you take, it doesn't help you more. Just the recommended dose does the same thing. If you take, say the recommended dose is just 2 pills, if you take 10 pills of Tylenol, it's not going to take the pain down anymore. If you take more Tylenol and more ibuprofen than the doctor recommends or the label on the box recommends, you're actually just damaging your kidneys and you absolutely need those to survive. Okay, so just be very careful that you're not taking too much Tylenol or too much ibuprofen, because even like one bad event can ruin your liver or your kidneys, and yeah, it's just not good. You can put a heating pad on your stomach. The heat from the heating pad relaxes the muscles and relaxes the tension. And the best thing is just distraction. You can have a friend come with you, like if you're just stuck in your bed and it just sucks so bad. You can have a friend like hang out with you, you can listen to music. If you're like really in pain, you can have that friend like, I don't know, massage your arm, tickle your back. It kind of tricks the brain to focus on the positive sensation rather than the painful sensation. And headaches. Same with headaches. First, if you're struggling with like a really bad headache, first you can assess the situation. Is this just like a regular headache that you have? Is it common? Is it reoccurring? Or is there something going on? Are you very dehydrated? Do you need to drink water? Have you been outside all day and then all of a sudden you have a headache? That might be a sign that maybe you don't need Tylenol. You need to drink some water, or you need electrolytes. Whenever you sweat, a lot of your electrolytes come out, like salt. Salt is a very important electrolyte that you need in your body. So if you drink a water bottle full of water and your headache is not going away, then it might be okay to ask the muggies for Tylenol or ibuprofen. Also, rest for your headaches, or have a friend like massage your head. Just massaging your head can just really relaxes, or like massage your shoulders. Sometimes a lot of headaches are caused from tension, like from like studying all day or working hard all day. Relieving the tension in your shoulders and your back with a simple massage can help reduce the headaches. But if you are outside and you're getting like headaches, you might have heat exhaustion. So being outside and like working hard and feeling like dehydrated or thirsty is different from like actual heat stroke and heat exhaustion. So heat exhaustion is whenever you're so hot and you're so overworked that you might feel dizzy. You might feel actual confusion, slurred speech, like changed vision, like things might be blurry. Or you're just like sweating profusely, like all your water is just leaving your body. You could be looking pale, like you've lost your color. You could feel nauseous, like you want to throw up, and you can feel your heart rate. Like if you have heat exhaustion, your heart rate will be like pretty weak, and it'll be really fast, where you can just kind of feel like maybe like butterflies in your chest, or something like going fast. In that case, you want to get out of the sun. Like your work day could be over at that point. Get out of the sun, cool off, take off, like if you have sweaters on, you're gonna want to take off all like unnecessary clothing. Sit in the shade, start sipping water. Make sure that you're also drinking electrolytes. If you don't have like a sports drink or an electrolyte packet, you can drink like a spoonful of honey with salt on it. Your body really needs salt. The more you sweat, the more your body needs the salt to be replaced. Let's see. Yeah. So just rest after that and rehydrate yourself and drink some electrolytes. If it's the next step towards heat stroke is life-threatening. You can recognize the difference between heat exhaustion and heat stroke if you're like completely stop sweating. Like if you're like hot, like if you feel like you're on fire but you're not sweating and you're just like super red and you can feel your heart beating really fast, like that's the time to call the ambulance and go to the hospital or have somebody drive you to the hospital. That's the next level of overheated. You don't want to be there. It's really bad. Let's see. Simple treatments for cold and flu. Cold and flu symptoms can be treated at home with rest and staying hydrated. You guys are going to be so surprised, but staying hydrated and giving your body lots of water solves almost all your problems. It's like the best solution ever. If you have a cold and flu, fever, if you feel hot, the muggins can take your temperature. But having a fever is absolutely normal. Having a fever is your body's way of fighting off the illness, like naturally, without taking antibiotics. So a fever is actually good for you. If your fever is under 102, if it's 102 and below, that's a healthy, good, normal fever. And it's actually really good. A fever is 102 Fahrenheit or like 38 Celsius. Do you guys use Fahrenheit or Celsius? Celsius? So if your fever is like 38 or below, it's benefiting you. It's killing off the illness inside you. If you take Tylenol or ibuprofen with fever, it's going to reduce your fever. It's going to help you feel better for a few hours, but it's going to prevent your fever from fighting off the illness. Okay? If you are having fever, you can rest and just treat the symptoms by staying hydrated and resting, drinking chicken broth. If your temperature is like over 103 Fahrenheit or over 39 degrees Celsius, you're going to want to go to the doctor. Tell the Mages or Auntie Alicia or Cece that your fever is like too high. If you have a fever that's over 103 or over 39 degrees, you can actually damage yourself. You can like lose your hearing. Good morning, Jamie. Yeah, you don't want your fever to be that high, so you're going to want to go to the doctor. If you are having like colored snot, like green snot or yellow snot, that's an indication for a bacterial infection, and you can take antibiotics from the doctor for that. If your snot is like clear, it's more than likely a viral infection, and the doctor probably will just tell you to go home and rest. Okay? Okay. If you see somebody choking, the typical signs are like people are like turning red or blue. They're like pointing towards their throat, and they're like, I can't breathe. Like it might be obvious if somebody's choking, but if you don't know what to do if somebody's choking, what you're gonna do is come up behind them. You're gonna grab your hands and just put it in between the belly button and like the rib cage, here where the stomach is, and you're gonna squeeze them in and up. And what that's gonna do is that's gonna force the pressure to like unlodge the food and have them spit it out. Okay, you can, if they're not spitting anything out, you can like check if there's like food in their mouth or if there's any way to help. But you're gonna continue like giving thrusts until they're able to spit it out. Okay? And if they never spit it out, that might turn into needing to do CPR. Has anybody ever learned how to do CPR here? Any of the young ladies in the chairs? Ever done CPR? Or has anybody seen CPR? Yeah? Okay. Okay, if somebody needs CPR or if you find somebody like totally unconscious, the first thing you're going to do is you're going to assess you're going to feel for a heartbeat. So if you just take 2 fingers and feel like somewhere on their neck, right here. Can you guys all find your own carotid artery? That pulsing that you feel is the blood flowing to the brain, which is good. If you don't feel a heartbeat on somebody's neck, the next thing you're going to do is you're going to listen for breathing. Okay, you're going to like bring your ear down to their throat or their mouth or their chest area. If you don't feel like chest rise or respirations, if you can't hear breathing, you're going to start CPR. Okay, to do CPR, you're going to put somebody like flat. Make sure that they're completely flat on the floor like this. Then grab their head and you're going to tilt it just so their airway is more open. Okay, you're going to find like the center of their chest, their bone right there. You're not going to go below the bone. You're going to feel the bottom of the bone, and then you're going to go up a little bit, just in this area here. And then you're going to push on that area, okay? To ensure that you have proper CPR, you're going to have to push really hard. Good CPR pretty much guarantees that you're going to crack their ribs. So if you're doing CPR, and it's just like this, you're actually just pretending to do CPR. You're not actually giving life-saving support. Okay, so you're gonna like put a good amount of weight. You're gonna want to go into their chest about 2 full inches, and you're gonna hear cracks and you're gonna feel cracks, and you're gonna think, oh gosh, I'm killing them even worse. But you're actually saving their life, because if somebody's not breathing and they don't have a pulse, the heart, when it pumps, it contracts like this, and you're gonna have to do that from the outside of the body. So light CPR, just barely pushing, it's not going to make the heart pump that it needs to, okay? So you're going to want to give compressions, about 100 to 120 compressions a minute, which it's kind of fast. You count like staying alive, staying alive, staying alive. That's about the rhythm that you're going to be pumping at the heart. And whenever you pump at the heart, you're going to want the chest to completely recoil back. If the chest is like pushed in and you're just pushing in on pushed in chest, it's not like letting the heart refill the blood to pump it again. Okay? So a full pump, come off. A full pump, come off. A full pump, come off. But not that exaggerated. It's going to be like that. What else about CPR? If there's a situation where you're going to have to give CPR, yes, pretend.
Is CPR different for a baby, Taylor?
Yes, but I'll be teaching infant CPR in the infant house after this class. So, I'll be teaching the moms and the muggies that later. If somebody's requiring CPR, you're going to want to stay calm. If you're freaking out, it's not going to help anything. So you're going to want to stay calm. You're going to have to designate somebody. Like if I found this person, they need CPR, I'm starting CPR, and I'm saying, Hannah, you need to find some help, you need to call. And now that's your responsibility. And then the person giving CPR is pretty much designated to stay with that person. Okay, you're going to go for about half a minute on CPR, and then you're going to give 2 rescue breaths. So CPR is pumping the blood around, but if they're not getting more oxygen into their body, you're just pumping like used blood all around. So about every half minute, every like 30 compressions, you're going to give 2 rescue breaths. You're going to want to make sure their head is tilted, you're going to plug their nose, and you're going to breathe in just 2 breaths. But you don't want to overfill their lungs, so not like mega huge breaths, just normal sized breaths. any questions about CPR? Yes, Chris?
How long do you do CPR for?
Until help arrives. So you're gonna get really exhausted doing CPR. You're gonna want to like find somebody to come and switch off with you. You're gonna give CPR for about like 2 minutes. 2 minutes of CPR time feels like an hour. And then you're gonna rotate. You're gonna have somebody take over and then you're gonna swap. And you're gonna continue CPR until the paramedics get there.
How many times you do it before you give them a breath?
It's typically 30 compressions and then you give 2 breaths. 30 compressions, 2 breaths. But if you can, you might not have a timer or you might not be counting because you're kind of just focusing on your rhythm. What feels like maybe half a minute. Then you give 2 breaths. Any questions? On anything? Even something that we didn't talk about? You guys have any questions? Huh?
I do ibuprofen. Because I'm taking 4 times as much as I should, twice as much as I should.
I'll talk to you after class.
Okay.
Yes, Hannah?
How do you know all this cool stuff?
I'm a nurse. I work in an emergency room in the United States. Yeah. I get to give IVs and help with procedures and do all the cool stuff and go into surgery. Yes.
Thank you.
If someone has fainted, are we supposed to pour cold water?
Cold what?
Cold water.
Cold water.
Oh, cold water if somebody fainted. If you have cold water available, if somebody faints, typically you're just gonna want to like give them any sort of like stimulation. Like you can like rub them like this, or gently shake them, or talk to them. But they should wake up pretty soon. Yeah, you can give them cold water. Unless they're like really, really confused, then you don't want to make somebody drink cold water because they can choke on the water and then you have a whole other problem on your hands.
If they are confused, you don't have to make them up.
If they're confused, if somebody faints and they're confused and they're waking up, you're going to want to just give them time and continue stimulating them and talking to them so they're encouraged to try to snap to it, and just pray for them and wait for them. If they continue passing out or if they go back unconscious again, you're going to want to call the paramedic. And if they stop breathing, you're going to want to check for a heart rate. If they lose their heart rate, you're going to do CPR. And pray. Just pray the whole time, every time. Are you raising your hands? No. Carry on.
If they hit their head, if they faint, and like hit their head on a counter or a block or something.
If somebody hits their head to where it's concerning, like if it's really bad, you're going to want to check their neurological status. Can they talk? Can they follow commands? Like, do they do what you say? If you say, can you squeeze my fingers? Can they follow that command? That's a good sign. You're going to want to look at their eyes. If their pupils are like different sizes, it's a really bad sign, and you're going to want to call CC like immediately. If somebody falls and hits their head and it might not be that serious, you might just want to monitor that they don't have any changes in their vision like later on in a couple hours, or if they get very, very tired and they just want to do, all they want to do is sleep and fall asleep, then that's a bad sign. And CC is your hero at that point. Yes, 6.
Can you talk about shock?
Shock? What kind of shock?
Treating shock like neurological or psychological shock.
That would be professional, and there's nothing that anybody here needs to learn. At that point, if somebody's like in shock, they need to be taken away by CC. But if you have questions, go your ask. Yes, MC.
What caused baby?
What?
What can cause baby? sometimes they are saying it's depression, and then sometimes they are saying you need to drink lots of water. But sometimes because the eye problem because of depression.
Headaches is a very general pain that the body feels. It can be from a number of things. Some people can be very sensitive to light. If you have a headache, you can try covering your eyes, and if the light helps the headache, then it can be like light induced. You could be dehydrated. You could be lacking certain vitamins in your diet. You could be lacking certain electrolytes like salt. Headaches can be total mystery, and nobody ever knows why you have a headache. They could be stress induced. They could be from like tension. If you're like writing all day and you're like gripping your pencil really tight, you could have tension up in your shoulders, and if your shoulder is tight, it results like in a tension headache. You can have headaches caused by like caffeine withdrawals, like if you start drinking energy drinks and then you stop drinking energy drinks, or if you're used to drinking coffee and you stop drinking coffee, you can have withdrawal headaches. You can have withdrawal headaches from sugar or like snacks. No, you really can. Like if your body is used to something and you stop giving it that whatever it is, like say you eat chips every day and then you stop eating chips, like you very well could get a headache for a couple of days because your body is like withdrawing from that, whatever it is in the chips that your body wants. Yeah, and stress, psychological stress, very, very often results in headaches. So if that's the case where like you can't figure out why you have headaches, a lot of the time the reason is like stress. And then you'd want to talk to Auntie Alicia about like maybe counseling or whatever it is, like identifying what's causing the stress and then dealing with that differently. And also just good old dehydration. Water saves headaches, guys. Any more questions? Well, welcome to, thank you for attending my first aid class. Do you have anything to add?
No, like that, I'm asking.
Go ahead.
So, I mean, I'm done. Thank you to Auntie Taylor for the class. So the announcement is right now at 3, we got to go down to the court for a volleyball match. Like we'll have 3 teams. And I would like to have some of you guys.